Little Jazz is on a field trip, and she isn't feeling well.
Questions. What's wrong, little Jazz?
Well, I'm not feeling well, and I'm a type 1 diabetic. I think I need to check my blood sugar.
Let's have a look.
Whoa, it's over 400.
That's really high. I wonder who can help.
Did someone say Lispro?
No. What's that?
You guys, Lispro is a fast-acting insulin that helps lower little Jazz's blood sugar.
How did you hear me?
Well, I happened to be on a break from a kidney transplant, and I just moseyed over after I heard of your little dilemma.
Well, is there anything I need to know?
There's plenty for you to know, little Jazz. Let's take a look into my little handbook, shall we? As you know, you have diabetes type 1, which is a metabolic disorder characterized by high glucose levels. Insulin reacts with a specific receptor site on the cell to promote storage of the body fuels, facilitates the transport of various metabolites and ions across the cell membrane, and stimulates synthesis of glucagon, glucose, fats, and protein.
Wow, you have a lot of knowledge. So what does Lispro do in my body?
Well, little Jazz, the preparations of Lispro are processed within the body just like the regular insulin produced by your own cells.
So,
Because Lispro is a hormone replacement drug, there are no contraindications, but you should not take Lispro if you are already hypoglycemic, and you should be cautious when pregnant or lactating.
Wow, did we just freeze? Anyway, how can I help her take her insulin?
Well, first you have to remember maintenance of doses are given by the subcutaneous route only, and injection sites need to be rotated regularly to avoid damage to the muscles and to prevent subcutaneous atrophy. Also, remember that your diet and exercises decreases the amount of insulin you'll take.
Patients taking Lispro should not take any other drugs that could lower the glucose levels, such as beta blockers or alcohol. When taken with beta blockers, it could also stop the sensation of hypoglycemia, causing the patient not to know when they're hypoglycemic. Side effects of Lispro include hypoglycemia and ketoacidosis, which can be controlled with proper adjustments of the insulin. You should also rotate injection sites so you do not get accumulation of scar tissue in your stomach.
Do you feel better, little Jazz?
yes, much better.
Okay, so what you've learned today is that first you have to check your blood sugar, then you have to choose the dosage that goes according with your blood sugar reading. Also remember, diet and exercise are a vital part of how insulin is going to be absorbed into your body.
Yeah.
When your blood sugar's high and you're feeling a fog, don't worry, take Humalog Lispro.